With 183 recoveries from COVID-19, total number of confirmed cases rises to 2,902 in India. 68 people have succumbed to the disease so far. 108 members of Sir Gangaram Hospital staff, including doctors and nurses, have been quarantined after they came in contact with two patients. Health Minister Dr. Harshvardhan visits 1,500 beds COVID-19 dedicated facility at Lok Nayak Jayaprakash Narayan Hospital, appeals to people to cooperate with health workers. Ministry of Home Affairs exempts shops of agricultural machinery, spare parts and truck repair shops on highways during a lockdown period. Also exempts tea industry, including plantations with maximum of 50% workers. MHA approves release of rupees 11,092 crores under State Disaster Risk Management Fund to all states. Global COVID-19 cases at 11 lakhs with nearly 59,000 deaths. US registers highest number of deaths, 1,418 a day. US President Donald Trump says government recommends Americans wear masks outside. Good afternoon. Hope you're doing well. I'm Shubhendu Ghosh. Let's look at the stories in detail. Union Ministry of Health and Family Welfare has released the latest figures on COVID-19 situation in the country. The active coronavirus cases in India stands at 2,650. There have been 68 casualties overall. Meanwhile, 183 patients have been fully cured and discharged. That's the update on the COVID-19 situation in the country. Meanwhile, as many as 108 doctors, nurses and other paramedical staff at Delhi's Gangaram Hospital have been put in quarantine after they came in contact with two patients who in their second test report were found positive for COVID-19. Of the 108, 85 are in home quarantine and 23 of them are in hospital. And Union Health Minister Dr. Harshvardhan visited COVID-19 dedicated facility at Lok Nayak Jayaprakash Narayan Hospital in the national capital today. The minister met officials at the Jayaprakash Narayan Hospital to discuss the situation of COVID-19. He said there are 1,500 beds here at this hospital. There are 290 COVID-19 positive or suspected cases admitted here.
लोकनायक अस्पताल में लगभग 2,000 बेड्स की व्यवस्था की गई है, जिसमें 1,500 बेड्स तो लोकनायक अस्पताल में और 500 बेड्स जीबी पंत हॉस्पिटल में। इस समय मैंने देखा कि यहाँ करीब 290 कोविड के पॉजिटिव या सस्पेक्टेड ऐसे कुल मिला के मरीज़ एडमिट हैं, जिसमें से 5 मरीज़ आईसीयू में हैं। वो थोड़ा सा उनको ऑक्सीजन सपोर्ट पर है, वेंटिलेटर इत्यादि पर नहीं है। मैं होम मिनिस्ट्री को निश्चित रूप से बधाई देना चाहता हूं कि उन्होंने कल निर्णय लिया है कि एनएसए के कानून के अंतर्गत ऐसे लोग जो हमारे डॉक्टर्स को या हमारे हेल्थ सिस्टम के साथियों को जो कि कोरोना वॉरियर्स की तरह काम कर रहे हैं, अगर कोई भी टारगेट करेगा तो उसके खिलाफ सख्त से सख्त कानून इस्तेमाल किया जाएगा।
The Health Ministry has issued an advisory on use of homemade protective cover for face and mouth. The ministry said that we are aware that social distancing and personal hygiene are key to prevent COVID-19 infections. Certain countries have claimed benefits of homemade face cover for the general public. Such homemade face cover is a good method for maintaining personal hygiene. Therefore, it is suggested that such people who are not suffering from medical conditions or having breathing difficulties may use handmade reusable face cover, particularly when they step out of the house. Homemade face cover is not recommended for either health workers or those working with or in contact with COVID-19 patients or our patient themselves. It is advised that 2 sets of such face covers be made so that one can be washed while the other is used. Such face covers should also not be thrown anywhere but kept safely, washed properly with soap in hot water and dried properly before they're used again. There must not be a sharing of face covers at all. That's the advisory that came in on the use of homemade face cover. In Bhilwara district of Rajasthan, patients after treatment are being discharged when found negative in the third reports. A doctor in Bangar hospital was tested positive for coronavirus, after which 26 people related to them were examined. 17 patients have reported negative, while 2 patients have died so far. Out of these 17 negative patients, 9 patients were given flowers and discharged by the district collector and hospital officers. They are advised to isolate themselves at home for a period of 14 days. Medical Superintendent MGH Bhilwara, Dr. Arun Gaur Bhilwara said that we are happy that 9 patients are corona negative and are leaving after treatment. We are currently having 7 more patients admitted and we're sure that we will overcome this virus outbreak.
भीलवाड़ा चिकित्सालय में 9 पेशेंट वायरस फ्री होके जा रहे हैं। इनके हमने 2 सैंपल लगातार 24 घंटे में नेगेटिव आने के बाद 14 दिन होने पर आज इनका तीसरा सैंपल भी नेगेटिव आने के बाद इनको हम 14 दिन के लिए होम आइसोलेशन में भेज रहे हैं। 14 दिन हम इसी स्पीड से, इसी भावना से अपने आप को कार्य करते रहेंगे। मेरी पूरी टीम संघर्षरत है और हम संघर्ष करेंगे और इस कोरोना को जीतने नहीं देंगे।
The patients say that we have won the battle of life today because of the doctors.
सब हमारे अच्छी सेवाएं की और इलाज बहुत अच्छी तरीके से किया और हमें ये सावधान रहना चाहिए और एक दूसरे की दूरी बनाए के रखना चाहिए, अच्छे हैंड वॉश करना चाहिए और बहुत बहुत धन्यवाद डॉक्टर्स को जो हमें आज कुशलता से घर भेज रहे हैं।
And now our correspondent Vishal Beristo will give us update on the situation in Rajasthan.
The number of positives in Rajasthan has crossed the 100 mark. As you can see, police are still trying very hard to tell people to stay indoors and adhere to the norms of the lockdown. This road takes us straight to the walled city which has been sealed because of obvious reasons. Another main concern for the administration is the attendees of the Tablighi Jamaat in Delhi. The numbers continue to rise, and yesterday experts from the World Health Organization visited people and administrative officers in Tok. With cameraman Anugrah, this is Vishal Beristo, DD India.
And a big news coming in from Agra. The Taj city has witnessed 25 new coronavirus cases, taking the total number of confirmed cases to 45 in the district. A total of 228 samples were sent to Lucknow's King George Medical University for examination. Of these samples, 25 turned out to be positive. The 25 new corona cases are also linked to Tablighi Jamaat incidents in Delhi's Nizamuddin Markaz. And further tightening the noose against violators of the curfew in the state of Punjab, the Punjab police has launched drone surveillance. The drones had so far been deployed in 34 locations across 10 districts of Mohali, Sangrur, Fazilka, Hoshiarpur, SBS Nagar, Barnala, Jalandhar, Rural, Moga, Ropar and Fatehgarh Sahib. The Punjab police has also cracked down heavily on black marketers and hoarders amid reports of shortage of essential commodities. A total of 62 establishments were raided on Friday. 23 were found to be indulging in black marketing or hoarding in Gurdaspur, Pathankot, Kapurthala, Jalandhar, with another 5 challaned in Firozpur, where penalty will be imposed after due procedure. Prime Minister Narendra Modi yesterday held a telephonic discussion with Benjamin Netanyahu, Prime Minister of Israel. Both leaders explored possible collaboration between India and Israel in fighting the COVID-19 pandemic, including by improving the availability of pharmaceutical supplies. PM Modi took to Twitter informing about the telephonic discussion. The two leaders agreed to maintain a focused channel of communication to explore synergies, besides improving availability of pharmaceutical supplies and innovative use of high technology. The leaders have been in touch ever since the coronavirus crisis started. Netanyahu agreed with Prime Minister Modi that COVID-19 pandemic is an important turning point in modern history and offers an opportunity to forge a new vision of globalization focused on shared interest of humanity as a whole. Ministry of Home Affairs has clarified on ground-level issues being faced by states in ensuring smooth flow of supply chain of essential items during the national lockdown to fight COVID-19. States have been advised to brief district authorities and field agencies to avoid ambiguity at ground level. Production, warehousing and transport of essential goods such as food, groceries, fruits and vegetables, dairy and milk products are included under exceptions in the guidelines. Taking the case of labs, the communication clarifies that they have been exempted from lockdown restrictions. These include testing labs in private sector for COVID-19 samples. Queries have been received as to what constitute food and grocery. State and union territories have been advised to interpret the terms to mean all items of food and grocery that are usually consumed by people on a day-to-day basis. Operations of railways, airports, seaports for cargo movement, relief and evacuation is also allowed under these guidelines. Interstate and intrastate within the state movement of all trucks, other goods carrier vehicles with one driver and one additional person is allowed as long as the driver is carrying a valid driver's license. All movement of persons with passes shall be subject to strict adherence to norms for hygiene and social distancing as is required in the context of COVID-19. Ministry of Home Affairs has also issued fourth addendum to the guidelines issued regarding amid 21-day lockdown to stop exempt shops of agricultural machinery, its spare parts including supply chain and repair, truck repair shops on highways, tea industry including plantations with maximum 50% workers. On directions of the Prime Minister, Home Ministry has approved release of rupees 11,092 crores under State Disaster Risk Management Fund to all states. Home Minister Amit Shah has announced the approval of the release of fund. Centre on 14th of March already made a special dispensation for utilization of State Disaster Response Fund (SDRF). This fund was allowed to be utilized for setting up quarantine facilities, sample collection and screening, setting up additional test labs, cost of consumables, purchase of personal protection equipment for the healthcare workers, municipal police, fire authorities, purchase of thermal scanners, ventilators, air purifiers and consumables for government hospitals. The central government is sensitive to the need for providing food and shelter to the homeless people, including migrant laborers who are stranded due to the lockdown measures. Accordingly, on 28th of last month, the central government allowed the states to use SDRF for this purpose as well. And ONGC and its energy soldiers are functioning 24/7 to ensure production and delivery of oil and gas, one of the most essential need items for the citizens of the country. In these exceptionally challenging times for the entire nation, the energy soldiers of ONGC have once again pledged to support the nation through their leadership and commitment by contributing rupees 300 crore from CSR fund and employees contributing 2 days of their salary amounting to around rupees 16 crore to PM Cares Fund created to combat coronavirus. The entire workforce of ONGC is working to ensure operations go unhindered. Central Railways has started converting ICF coaches into isolation and quarantine wards. 482 such coaches will be converted into isolation wards. In Mumbai area, this work will be done at Matunga and Parel workshops and Wadi Bandar and LTT depots. More than 50% coaches will be converted into isolation wards at 2 workshops and balance in other various coaching depots of Central Railway. Work has already started in these workshops and other various coaching depots of the Central Railways. As the country is fighting COVID-19 pandemic, Indian Army is dutifully performing their responsibilities, while the police and administration are facing challenges to ensure lockdown across the nation. Soldiers of Chinar Corps have extended solace to the Kashmiri people in high altitude areas, braving the glaciated terrain and piercing winds. Chinar Corps are not only spreading awareness about COVID-19 but also providing ration and other essential items to people living in high altitude. The entire area is also being sanitized by the troops. In Rajasthan, Bagru police station of Jaipur has taken a unique initiative. With the joint efforts of police and the common folk, a herbal sanitizing chamber has been formed. The purpose of this chamber is to save people from infection of coronavirus. The herbal sanitizer is made by neem, tulsi, marigold flower and spirit, a homeopathic sanitizer. As soon as someone enters the chamber, a spray of water mixed with herbal drugs is sprayed on the body. This herbal sanitizer will sanitize the entire body in the chamber and prevent infections like coronavirus. Two-wheelers can also be boarded from this chamber, as you can see in the visuals.
इसका उपयोग ऐसे हो रहा है कि जैसे कि कोई भी इस टनल में से चैम्बर में से पास हो रहा है, तो इसमें जो भी नोजल्स बने हुए हैं तो पूरी बॉडी पर उसकी वाष्प जाती है और वाष्प जाने से उसकी पूरी बॉडी और व्हीकल जिस व्हीकल से जा रहा है व्हीकल भी सैनिटाइज हो रहा है और संक्रमण का खतरा न्यूनतम कम से कम हो रहा है, खत्म हो रहा है। इससे अवेयरनेस भी आ रही है और संक्रमण का खतरा भी कम हो रहा है, खत्म हो रहा है।
Amid lockdown, CRPF men in uniform serving food to the destitute near AIMS in the national capital. These brave men in uniform are also providing sanitizer, masks and fruits along with food and water. The video that you're looking at shows men from 70 and 55 Battalion. And amid the lockdown, people are finding new ways to quality time passage at their homes. Uttar Pradesh badminton player Shishma Kumar is also working on a hidden talent and exploring with them. Painting and artistry seems to be her calling. In other news, an encounter broke out between security forces and terrorists in Hadmanguri, Mansgam, Kulgam in Jammu and Kashmir today. The police said a Hizbul Mujahideen group of some 3 to 4 terrorists were killing civilians over the last 12 days. 4 such killings were done by them in South Kashmir. Police was able to track them down and an operation was launched this morning by police, SF, army, in which 4 of them were neutralized. And here's an overview of the COVID-19 pandemic that is raging across the globe. Take a look at this special graphical presentation. Meanwhile, global cases of novel coronavirus have shot past the 1 million with more than 59,000 fatalities as the death toll soared in the United States and Western Europe, while the world economy also nosedived. Italy saw more evidence that it might have made it through the worst of the coronavirus pandemic as the daily rise of officially registered infections dropped to a new low of just 4%. The number of people who have been declared fully recovered has also soared by 17.3% to 19,758 over the past 48 hours. Now the death toll tally in the country stands at 14,681 in Italy. Also, the situation in some of Italy's worst hit regions like Lombardy also appears to be gradually easing. In the meantime, Russian military carried out sanitation and disinfection procedures in 3 senior care centers in the municipalities. The epidemiologists also formulated a list of recommendations for the management and medical staff of the centers on how to maintain proper anti-epidemic control practices and prevent the infection from spreading. As US registered a new global record of 1,480 virus deaths in just 24 hours, US President Donald Trump expanded the role of the US Army in the fight against the deadly coronavirus. He said that no one is better prepared to fight the current situation, which is like a war. The president said that the government is expanding the role of armed forces in response effort because no one is better prepared to win the war of United States military. And we are in a war, he said, invisible enemy. This development comes as members of White House task force on coronavirus expected the deadly disease to peak in the US in about 10 days. Meanwhile, battling with the deadly coronavirus, people in Wuhan, China, mourn the death of thousands who have lost their lives to the outbreak, stopping in their tracks while horns blast through the city. The mourning coincided with the start of the annual Qingming Tomb Sweeping Festival, when millions of Chinese families pay respects to their ancestors. In Wuhan, that was earlier the epicenter of the outbreak, capital of Hubei province, the epicenter, all traffic lights in urban areas turned red for a while, and all road traffic ceased for 3 minutes. Cars, trains and ships sounded their horns. Air raid sirens wailed while pedestrians stopped walking, and many bowed their heads in a solemn moment of silence. Some 2,567 people have died in the city of the 11 million people, accounting for more than 75% of the country's coronavirus fatalities. And as coronavirus scare continues to tense people, National Award-winning Gujarati writer, director and producer Abhishek Shah shares a special appeal to people. Let's listen in to what he had to say.
मेरा नाम अभिषेक है। आज देश कोरोना वायरस की महामारी से जूझ रहा है। हमें सिर्फ इतना करना है कि हमें घर पर रहना, कि वायरस को फैलते हुए रोकना है। दूसरी एक बहुत इम्पोर्टेंट बात यह है कि ध्यान रखना है कि हम लोग अफवाहों को ना फैलाएं। प्रशासन बहुत अच्छा काम कर रहा है, प्रशासन को हमें मदद करनी चाहिए और ध्यान रखना चाहिए कि वायरस लोगों तक ना पहुंचे, घर पर रहेगा और सुरक्षित रहेगा।
And with that, we conclude this bulletin. Remember to maintain personal hygiene, stay at home and take good care of yourself. Namaskar.